If Medicare has denied coverage for a medical service, hospital stay, or piece of equipment, you're not alone. Medicare denies millions of claims every year, and most people simply accept the denial and pay out of pocket. But here's what they don't tell you. You have the right to appeal any Medicare denial. The appeal process is free, and over 73% of people who appeal win at least a partial reversal. That means nearly 3 out of 4 people who fight back get their claims covered. In this video, I'll walk you through exactly how to appeal a Medicare denial step by step, what documents you need, and how to maximize your chances of winning. Section 1. Why Medicare denies claims. Medicare denies claims for several common reasons, and understanding which one applies to you is the first step in fighting back. Reason 1. Medicare says the service wasn't medically necessary. This is the most common denial. Medicare has strict rules, and if your service doesn't meet their criteria, it gets denied. Reason 2. The service isn't covered by Medicare at all. Routine dental care, most vision services, and hearing aids fall into this category. Reason 3. You received care from a provider who doesn't accept Medicare. If a doctor or facility isn't enrolled, Medicare won't pay. Reason 4. The service was provided during an observation stay instead of an inpatient admission. Observation status can limit what Part A covers. Reason 5. Paperwork errors or missing information. Incorrect codes or incomplete documentation are common and often the easiest denials to overturn. When you receive a denial, Medicare sends an explanation. Read it carefully to identify the reason. Section 2. The 5 levels of appeals. Medicare has a 5-level appeals process, but most people win at level 1 or 2. Level 1. Redetermination. You file this with the Medicare administrative contractor that processed your claim. You have 120 days from the denial notice. A different reviewer looks at your claim and new evidence. Level 2. Reconsideration by a qualified independent contractor. You have 180 days after a redetermination denial. Level 3. An administrative law judge hearing if your claim is worth at least $200. You have 60 days to request it. Level 4. A review by the Medicare Appeals Council within 60 days of the ALJ decision. Level 5. Federal court if your claim is worth at least $1,850. Most people never go beyond level 1 or 2. The key is building a strong case early. Section 3. How to file your appeal. Here's how to file a level 1 redetermination. Step 1. Don't wait. You have 120 days, but file as soon as possible. Step 2. Get the right form. For original Medicare, use CMS 20027 from medicare.gov or call 1-800-MEDICARE. For Medicare Advantage, contact your plan directly. Step 3. Gather documentation. Get a letter from your doctor explaining why the service was medically necessary. Include relevant medical records, test results, and reports. Step 4. Write a clear explanation. Be specific about why the service meets Medicare's criteria and how the denial affects your care. Step 5. Submit everything together. Send the appeal form, denial notice, and all supporting documents to the listed address. Keep copies and use certified mail. Step 6. Follow up. If you haven't heard back within 60 days, check on your appeal status. Section 4. What makes a strong appeal? First, get detailed medical necessity documentation. A short note isn't enough. Your doctor should explain your diagnosis, why this service is necessary, what alternatives failed, and what happens without it. Second, reference Medicare coverage policies. Local and national coverage determinations outline what Medicare covers. Showing that you meet these criteria strengthens your appeal. Third, provide evidence that the service is standard medical practice. Medical journal articles or professional guidelines help support your case. Fourth, address the exact reason for the denial. If Medicare said it wasn't medically necessary, prove that it was. Section 5. Special situations. If Medicare denied a hospital stay due to observation status, appeal using the Moon notice. If the hospital failed to provide it, that strengthens your case. Include a doctor's letter explaining why inpatient admission was required. For any durable medical equipment, your doctor must explain why the equipment is medically necessary and why alternatives aren't sufficient. If a skilled nursing facility stay was denied, document the 3-day inpatient stay and show that skilled care, not custodial care, was required. Section 6. Getting help. You don't have to do this alone. Your state health insurance assistance program, SHIP, offers free counseling and appeal help. Call 1-800-Medicare to find your local SHIP. For complex or high-dollar claims, consider a Medicare attorney or advocate. Many work on contingency and only get paid if you win. Disease-specific advocacy organizations can also help, especially for cancer, diabetes, or chronic conditions. A Medicare denial is not the final word. You have rights, an appeals process, and a strong chance of success. 73% of people who appeal win. If this video helped you fight a Medicare denial, please like, subscribe to Medicare Clarity for Seniors, and share it with anyone facing a denial. Thanks for watching, and I'll see you in the next video.